What are the home remedies which are used to control bedwetting in children? Most children outgrow bedwetting on their own. If treatment is needed, it can be based on a discussion of options with your healthcare provider and identifying what will work best for your situation. If your children isn't especially bothered or embarrassed by an occasional wet night, lifestyle changes such as avoiding caffeine entirely and limiting fluid intake in the evening may work well. However, if the lifestyle changes aren't successful, if your grade schooler is terrified about wetting the bed, he or she may be helped by additional treatment. If found underlying causes of bedwetting such as constipation or sleep apnea should be addressed before other treatment. Options of treating bedwetting may include moisture alarm and medication. Here are changes you can make at home that may help. Limiting fluid intake in the evening. It is important to get enough fluid, so there should be no need to limit how much your children drink in a day. However, encourage drinking liquid in the morning and early afternoon, which may reduce the thirst in the evening, but don't limit evening fluid. If your child participates in sport practices or game in the evening. Number second, avoid beverages and food with caffeine. Beverages with caffeine are discouraged for children at any time of the day because caffeine may stimulate the bladder, especially discouraged in the evening. Number third, encourage double voiding before bed. Double voiding is urinating at the beginning of the bedtime routine and then again just before falling asleep. Remind your child that it is okay to use the toilet during the night if needed. Use small night lights so your child can easily find the way between the bedroom and bathroom. Number 5. Encourage regular toilet use throughout the day. During the day and evening, suggest that your child urinate every 2 hours or so, or at least often enough to avoid feeling of urgency. Number 6. Prevent rashes. To prevent a rash caused by bedwet underwear, help your child rinse her or her bottom genital area every morning. It may also help to cover the infected area with a protective moisture barrier ointment or cream at the bedtime. Ask your pediatrician for the product recommendation. Alternative medicines. Some people may choose to try complementary or alternative medicine approaches to treat the bedwetting. For approaches such as hypnosis, acupuncture, chiropractic therapy, and herbal therapy, evidence of effectiveness of the bedwetting is weak and inconclusive, or such efforts have provided to be ineffective. In some cases, the study were too small or not rigorous enough or both. Be sure to talk to your child healthcare provider before starting any complementary or alternative therapy. If you choose a non-conventional approach, ask if it is safe for your child to make sure it won't interact with any medication your child may take. Coping and support. Children don't wet the bed to irritate their parent. Try to be patient as you and your child work throughout the problem together. Effective treatment may include several strategies and may take time to be successful. Be sensitive to your children feeling. If your child is stressed or anxious, encourage him or her to express those feelings. Offer support and encouragement when your child feels calm and secure. Bedwetting may become less problematic if need. Talk to your pediatrician about additional strategies for dealing with stress. Plan for easy cleanup. Cover your child mattress with a plastic cover. Use thick absorbent underwear at night to help contain the urine. Keep extra bed and pajama handy. However, avoid long-term use of diapers or disposable pull-up underwear. Enlist your child's help. If age appropriate, consider asking your child to rinse her or her wet underwear and pajama or place these items in a specific container for washing. Taking responsibility for bedwetting may help your child feel more control over the situation. Celebrate effort. Bedwetting is involuntary, so it does not make sense to punish or tease your child for wetting the bed. Also, discourage siblings from teasing the child who wet the bed. Instead, praise your child for following the bedtime routine and helping clean up after accident. Use a sticker reward system if you think this might help motivate your child.